Hello and welcome to Medverse. Today we are discussing about an important topic regarding your kidneys. Let's talk about renal diet. People with compromised kidney function must adhere to a renal or kidney diet to cut down on the amount of waste in their blood. Wastes in the blood come from food and liquids that are consumed. When kidney function is compromised, the kidneys do not filter or remove waste properly. If waste is left in the blood, it can negatively affect a patient's electrolyte levels. Following a kidney diet may also help promote kidney function and slow the progression of complete kidney failure. A renal diet is one that is low in sodium, phosphorus, and protein. A renal diet also emphasizes the importance of consuming high-quality protein and usually limiting fluids. Some patients may also need to limit potassium and calcium. Every person's body is different, and therefore it is crucial that each patient works with a renal dietitian. Work to come up with a diet that is tailored to the patient's needs. Let's talk about sodium. Sodium is one of the body's three major electrolytes. Sodium contributes to regulating blood pressure and blood volume, regulating nerve function and muscle contraction, regulating the acid-base balance of blood, balancing how much fluid the body keeps or eliminates. Why should kidney patients monitor sodium intake? Too much sodium can be harmful for people with kidney disease because their kidneys cannot adequately eliminate excess sodium and fluid from the body. As sodium and fluid build up in the tissues and bloodstream, it may cause increased thirst, edema, swelling in the legs, hands, and face, high blood pressure, heart failure. Excess fluid in the bloodstream can overwork your heart, making it enlarged and weak. Shortness of breath. Fluid can build up in the lungs, making it difficult to breathe. Food with low sodium levels are fresh meat, fresh dairy, frozen vegetables and fruits, garlic, lemon, onion, cilantro, oregano, rosemary, vinegar, pretzels, unsalted popcorns. Try to avoid salted snacks, canned food, processed meats, fast food, table salt in high amounts. What is potassium and its role in the body? Potassium is a mineral found in many of the foods we eat and is also found naturally in the body. Potassium plays a role in keeping the heartbeat regular and the muscles working correctly. Potassium is also necessary for maintaining fluid and electrolyte balance in the bloodstream. Why should kidney patients monitor their potassium intake? When the kidneys fail, they can no longer remove excess potassium, so potassium levels build up in the body. High potassium in the blood is called hyperkalemia, which can cause muscle weakness, an irregular heartbeat, slow pulse, heart attacks. Death food with low potassium are apples, berries, grapes, papaya, pure spine apples, watermelon, white meat, eggs, rice, tuna, bell pepper, broccoli, carrots, cucumber, green beans, lettuce, fresh mushrooms. 1 small piece for fruit, half cup fruit juice, half cup fresh or cooked vegetable. 3 ounces of cooked meat, 1 slice of bread, 1 egg, half cup cooked rice noodles, or pasta are examples of 1 serving. What is phosphorus and its role in the body? Phosphorus is a mineral that is critical in bone maintenance and development. Phosphorus also assists in the development of connective tissue and organs and aids in muscle movement. When food containing phosphorus is consumed and digested, the small intestines absorb the phosphorus so that it can be stored in the bones. Why should kidney patients monitor phosphorus intake? When kidney function is compromised, the kidneys no longer remove excess phosphorus. High phosphorus levels can pull calcium out of your bones, making them weak. This also leads to dangerous calcium deposits in the blood vessels, lungs, eyes, and heart. Low phosphorus foods can be all fruits, all vegetables, white bread, white rice, pasta, egg and fresh meat, tea, non-dairy coffee. It's better to avoid frozen, uncooked meat, frozen baked goods, cereals, sauces, instant puddings, nuggets. Now let's talk about protein. Protein is not a problem for healthy kidneys. Normally, protein is ingested and waste products are created, which in turn are filtered by the nephrons of the kidney. Then, with the help of additional renal proteins, the waste turns into urine. In contrast, damaged kidneys fail to remove protein waste, and it accumulates in the blood. The proper consumption of protein is tricky for chronic kidney disease patients, as the amount differs with each stage of disease. Protein is essential for tissue maintenance and other bodily roles, so it is important to eat the recommended amount for the specific stage of disease, according to your nephrologist or renal dietitian. How about the fluids? Fluid control is important for patients in the later stages of chronic kidney disease because normal fluid consumption may cause fluid buildup in the body, which could become dangerous. People on dialysis often have decreased urine output, so increased fluid in the body can put unnecessary pressure on the person's heart and lungs. A patient's fluid allowance is calculated on an individual basis, depending on urine output and dialysis settings. It is vital to follow your nephrologist's, nutritionist's fluid intake guidelines. To control fluid intake, patients should not drink more than what your doctor orders. Count all foods that will melt at room temperature, Jell-O, popsicles, etc. Be cognizant of the amount of fluids used in cooking. What are the benefits and risks of renal diets? Sticking to a renal diet can help you manage your kidney disease and related complications, so you can have a healthier life and feel better. Renal diet risks. A renal diet doesn't have any risks. Because it's also heart healthy, it can improve both your kidney and complete health. Some people may feel overwhelmed by the renal diet and end up being overly restrictive with their food intake. If you feel this way, work with your doctor or dietitian to discuss food and drink choices that work for you. Who should follow a renal diet? Anyone with kidney disease should think about a renal diet. Your doctor may want you to meet with a registered dietitian to discuss renal diet considerations and learn recipes. If you have advanced kidney disease or other health conditions, your doctor or dietitian may have different guidelines for your renal diet. For instance, people with early kidney disease versus those on dialysis may need to restrict their protein intake. They may also need more potassium. Renal diet tips. There are tips to keep in mind if you or a loved one is on a renal diet. Choose fresh foods and cook from scratch as much as you can. Avoid fast food and packaged foods. They're high in sodium. Use spices and fresh or dried herbs instead of salt to flavor food. Rinse canned beans and vegetables before cooking to help remove excess salt. Keep protein serving sizes small. A serving size of protein is 2 to 3 ounces of chicken, fish, or meat. Limit alcohol to 1 drink a day for women and 2 for men. So that's it for today. Thank you for joining. Until we meet you with another interesting episode, take care and stay healthy.